of the bill. Senator Isakson.
Thank you, Mr. Chairman, and thanks to you and Ms. Murray for the job y'all are doing on the opioid issue, which is a big issue. Ms. Nichol, I agree with you that it's important to put a face on the problem because it is a terrible problem in our country. My grandson died of an overdose in 2016. He was one of the 63,300 that you listed in your testimony who died in 2016 from an opioid overdose. He died 2 nights before he was going to get a summa cum laude diploma in mathematics from the University of Georgia Southern. He had been out of recovery for 4 years, had been in a great program. We thought he was back. He was doing terrific in school, obviously getting a summa cum laude diploma, but he also was working. He had a job when he finished. We were excited. And then we got the phone call late at night, 2 days before the graduation, that he had been found dead in his apartment in Statesboro, Georgia, which I bring up to say this. You never know where narcotics and opioids and overdose death is going to come from. You never know who it's going to affect. You never know how they got exposed, and many times most of the subjects around are a mystery. But the better you can know your children and your kids and your grandkids, the more you can look for things and ask questions, the more you can try and be aware of the symptoms of drug abuse or addiction, the better off all of us are going to be. And addiction is the big problem. I mean, I'm personally convinced. I mean, Charlie was a great kid, smart as he could be, but he was hooked. And no matter how long you stay out in recovery and are free of drugs, it only takes one. And that's all it took for him 4 years after he had gone into recovery. And that's a sad testimony. Yesterday in a hearing we had in another committee, we heard that children 13 to 26 are 5 times as likely to become addicted on narcotics as adults. Do y'all agree with that number? Is that about right in your mind? Well, that shows you, Mr. Chairman, one of the places we've got to put a face on the opioid epidemic is with our young people, to really know what they're facing and can happen. The Meth Project, which started in the Midwest, upper Midwest, on methamphetamine a few years ago, did a lot of good to knock down the growth rate in terms of meth laboratories and meth addictions in that part of the country. And it helped us in Georgia. We adopted a meth project in Georgia and put the billboards up like you've got with your samples with your speech. But all that education, all that awareness, all that knowledge, all that talking about the subject in public and with your kids and families is critically important, because awareness is the key to catching things early, if you're lucky enough to be able to do that. If you don't catch it early enough to get treatment, and then sustain the treatment and the benefits of that treatment long enough so the person can lose the addictive habits that they developed in taking the narcotics or the opioids. And so I just want to commend you on what you focus on in terms of awareness and putting a face on it. It's a terrible tragedy that many, many Americans face every day, and more are going to face in the future unless we do get our arms around it. And we can do it, but we've got to talk about it without fear. We've got to look for the symptoms without any prejudice. We've got to do everything we can to support those who are having problems rather than demonizing them because they have them. They need our support and our love and our assistance and our help, and we can help a lot of people end what is a terrible problem. And I would just say, Mr. Chairman, I want to end where I started. Addiction to me is it. It's the one thing that is so overpowering. And I can't explain. I know there are things I like to eat that I shouldn't eat. There are things that I buy at the grocery store. My wife goes crazy. It's a good thing that Oreos aren't addicted, because I would be on them every day. But addiction and the habits that come with it, and the things you do to support the habit early on that are so detrimental to your health in the future and your life in the future are unbelievable. So what we're doing in this committee, what the chairman and the ranking member are doing, is critically important, and what all of us need to do in this country is make sure that drug abuse is not a stigma. It's a problem, and addiction is not a stigma, it's a disease, and that we treat it, we find a way to cure it, and we save lives in the future. And that's what this committee is all about, and I commend you and Senator Murray for what you're doing to make that happen.